After pushing my body to breaking point multiple times, I needed to find a better way to train. The problem was obvious. I was getting older. And my body was getting stiff, weak, and beat up by my archaic training methods. But I wasn't ready to accept that my best years were behind me. So I teamed up with leading experts in physical therapy and strength and conditioning to explore new training methods that would help put my pain behind me and hopefully regain some performance. What I learned surprised me. Instead of recommending rest and basic rehab exercises, they were all proponents of the same 3 training principles. Number 1, don't stop training. Motion is lotion for your lower back. Number 2, train to promote limb symmetry and opposing muscle balance. And number 3, train to balance your strength and flexibility in each workout. Now, most people have an all or nothing mentality when it comes to injury management, as though if we can't do our regular routine, then working out is futile. This is not correct. At Unity Gym, we have a saying, motion is lotion, meaning you should maintain physical activity in the presence of injury. Because abstinence from exercise causes a loss of strength and conditioning everywhere, not just in the injury. This might be as simple as practicing a deadlift with a weightless dowel rod, or learning to squat properly using only your body weight. In addition, we start by training the pain-free range and progressively increase the range of motion. Now, the principle of progressive overload is something that I'll discuss more in this series, but the common theme here is that one should seldom stop exercising when suffering lower back pain. Often this may contradict how you feel, especially after a nasty diagnosis. But it's important to understand that you are not your morphology, meaning what shows up on your MRI or X-ray doesn't always accurately or logically represent what's going on in your body. For example, this X-ray of my spine shows severe spondylolisthesis and degeneration of my lumbar spine, warranting surgery. But I'm completely pain-free, with exceptionally high physical capability. And although scans help provide useful information for your doctor or physical therapist, they should never determine the course of action alone. Therefore, don't let your diagnosis discourage you. Only increased strength and flexibility under the right protocols will fix your back. You need to promote limb symmetry and opposing muscle balance. And if you click or tap the screen there, in part 2 of this series, I'll teach you exactly how to do that. I'll see you in that next video.